And with that, I will introduce myself to hand it off, as I'm going to be moderating this next session as well, with two people I know very well because I work with them here at ConsenSys Health. One is my boss and one is my colleague, and but both are my friends and both have a very similar vision to what I have on what can be done to really transform health with different looks at what technology can do as a tool, not as a fix-it-all, for improving how we handle data. I'll give it just a moment because I think Dr. Passerat-Palmbach is going to be joining us from the UK. But first, I'll reintroduce Heather Flannery, who you saw give us the opening intro as the CEO and founder of ConsenSys Health, and maybe you'd like to say a few words about what you've been seeing and hearing so far while we wait for Jonathan to come online.
Sure, Dr. Manion, thank you so much. It has been an honor and a privilege to witness today's discussions. I am remarkably humbled at the group of people who have come together to contribute to this content in service to those who served. We are really moved, and some of these conversations have been so impactful, and I really look forward to continuing them and keeping the momentum going. So I would just like to add another thank you to our esteemed speakers today and through the rest of today. Really, really amazing. And of course, I'm really excited, given the whole context of what we've discussed, to spend a little bit of time with all of you focusing on the art of the newly possible, which is the theme of our three-part fireside chat between Drs. Manion, Passerat-Palmbach, and myself. For any of you who may have missed my intro at the beginning, in addition to being the founder and CEO of ConsenSys Health, I'm also the co-chair of the blockchain task force at HIMSS and chair a standards development working group at IEEE focused at the intersection of healthcare and life sciences, blockchain, and machine learning. So I wear a number of hats in the industry and focus a lot on systems thinking and the interconnectedness of complex adaptive systems and what we need to do to achieve our shared goals. So that's a little bit about me. Should I get started on the presentation and then we'll pick up on the discussion?
I think that would be best. We're trying to get JPP in, and the slight time shift may have gotten tripped up over the water. So we'll bring him in from the UK on the run, and you can start us off with the presentation and start walking us through it, and we'll pick up the conversation after that.
All right, terrific. Let me know when you're able to see my screen. All right, very good. Always in front. Okay. Terrific. So I mentioned at the beginning of this, the art of the newly possible. What I'd like to emphasize for those of you with 10, 20, 30, 40-year professional careers that have grown up in client-server architectures and have become completely acclimated and comfortable with client-server architectures and then how it moved to the commercial internet. There are a wave of technologies that are reaching viability at this point in 2020 that are equally disruptive to the transformation that we saw with the dawn of the commercial internet. And those of us at a little bit later point in our careers have an opportunity to have a do-over of what happens when there is a massive wave of brand new technology that hits civilization. Our last revolutions in technology, unfortunately, did not bring everyone along. We ended up with a massive digital divide, a worsening of disparities, a crisis in physician suicide due to the dehumanization of the art of medicine, and more. We know that emerging technologies hitting a civilization can have unintended consequences, always have had unintended consequences. And right now, we've got innovations of significance along the lines of the Gutenberg printing press, the steam engine, the integrated circuit, the dawn of the commercial internet. And we've got several of these all hitting at once, and the technologies are converging. There are extraordinary positive potentials for humanity, and there is also extraordinary risk and reason for circumspection, sobriety, and being ethically intentional as we approach these changes. So moving into that, we've been teasing you with these 5 emerging technologies. You know, what are they? What are they that we're saying are going to be so transformative? Well, first, we're going to talk about blockchain and the role that decentralized identity, which is a technology facilitated by blockchain, can have on our industry. We'll define it for you. We'll give you some insight as to why it may seem tricky to put your finger on exactly what it means. We'll talk about tokenization, which is an optional aspect, another optional dimension of what can be facilitated via blockchain, and the creation of digital scarcity, something we've never had before, that activates economic principles in a technology context in a way that creates entirely new business models, opportunities to apply game theoretic principles, and more. Artificial intelligence has been with us for a long time and evolving. Many of you have been through multiple spring, summers, and winters of AI in our industry. Decentralized artificial intelligence is brand new and highly compelling and introduces radical new possibilities and risks for us to discuss. Zero-knowledge cryptography is honestly new tech. All the cryptography that's involved in linking blocks in a blockchain is actually legacy crypto, if you will. It's not, it is not new cryptography, it's old cryptography applied in a new way or a novel and innovative way. Zero-knowledge cryptography is something materially and substantively different that has never existed in the world. It's based on mathematics that were only developed about a decade ago in the original innovations. And the first computer science applications only appeared 5 to 7 years ago. And now we, those of us at ConsenSys Health and colleagues, are bringing this technology to global industrial scale. But we'll explain what it is and why it is so substantively different from the cryptography that all of you understand. Lastly, and most absolutely not least, we're going to talk about verifiable and confidential computing. A foundation of decentralization and the emergence of blockchain architectures is the abstraction of capabilities that currently live inside the 4 walls of enterprises and their IT departments up into new classes of infrastructure that do not exist today, that are federated and mutualized, that have different models for ownership, governance, and control. That means the trust model for those systems must necessarily change, which is why verifiable and confidential computing is on the critical path to applying this family of technologies to an industry as sensitive and as connected to the life of every human being on Earth as these. So for those of you not focused on the blockchain space, it's probably a conclusion you reach that this is extremely early technology. It's years and years away. It's not ready yet. You probably hear a lot of messages along those lines. I'm going to respectfully disagree and let you all know that the largest healthcare enterprises in the world have all been working on applied R&D, experimentation, planning, and business development regarding new models with blockchain technology since 2017, 2018. The Synaptic Health Alliance was announced in April of 2018, and of course was in development substantively before that. That includes industry leaders under United Health Group like United Healthcare and Optum, Quest Diagnostics, Aetna, and many more. The Synaptic Health Alliance has led the way on not only technology implementation with something brand new and emerging, but methods of governance, methods of capital formation, methods of examining how it is that different aspects of what we do in our industry can be removed from the basis of competition and mutualized. How does a rising tide lift all boats? That is a phrase we've all used for many years. It is the central model to apply when thinking about how to apply these technologies in our industry. What can be removed from the basis of competition? What can be decentralized and abstracted up? As you see, there are many more coalitions, more beyond this list of 5, but what's critical to know is that it involves, many of them involve partnerships between the public and private sector, like in the European Union with the Innovative Medicines Institute. You have 14 of the largest pharmaceutical manufacturers in the world in close collaboration with a function out of the European Commission in order to bring these technologies to a particular geography in the European Union. Our hypothesis at ConsenSys Health is that it is absolutely necessary to contemplate these transformations of our industry as partnerships between the public and private sector, and also at multiple levels of government and across stakeholder groups. So if you're curious about what blockchain is in the first place, don't feel badly, because you've probably read a bunch of articles, you've probably seen a lot of things, and still somehow come away feeling confused about how to put your finger on the exact definition. There's a simple reason for why it's so confusing, and it's that it's more than a technology, and it's a technology that exists simultaneously at multiple layers of the engineering stack with which we're familiar. So you could sort of choose a lens and define it from that context, and you'd be correct. You simply would not have a complete definition. In addition to being a technology, blockchain is as much an innovation in the arena of behavioral economics. It created a new discipline, applied behavioral economics, in real time. It is a brand new opportunity to express game theoretic principles, form hypotheses, and test the way that different incentives designs inform stakeholder groups. Structurally, it opens the door to brand new business models that have never been logistically possible before, and therefore have never been meaningfully considered. And lastly, it opens up the door for radical new levels of personal or self-sovereignty. These are in multiple areas, but in simplicity, this includes one's identity, it includes credentials or verifications about who you are, and it includes your data or data about you. All of those things are made possible by blockchain. Blockchain exists when it's implemented in the form of networks. Those networks can be public resources, public infrastructures, neutral platforms like the Ethereum mainnet, like the Bitcoin blockchain. The Ethereum mainnet specifically we focus on because it can run software that can focus on any kind of application, not only digital money, but any sort of software application. Private blockchain networks will have completely different characteristics, but will have certain of the same benefits that a public blockchain will have. In our industry, my personal opinion is that our end state will look like hybrid networks. Lots and lots of private enterprise networks that are bridged or tethered through a single neutral public infrastructure. Another defining characteristic of blockchain, particularly newer blockchains like Ethereum and other platforms, are the ability to execute and run smart contracts. Just to keep you on your toes, those are neither smart nor contracts. I cannot take responsibility for that terrible naming convention. It is what it is. If you're a database person, they're kind of like cryptographically stored, cryptographically verified stored procedures expressed as microservices that run on a blockchain infrastructure. The key is that smart contracts facilitate secure automation across organizational boundaries. All of the last 30 years of efficiency work, every Six Sigma black belt, all of the work has all been looking inward into the four walls of any given enterprise. this infrastructure for the first time allows us to use the same kinds of principles for automation and efficiency gains at an ecosystem level in a three-dimensional array. It's an extremely high potential technology. In addition, blockchain creates the possibility for digital scarcity. And if you think about it from the perspective of economics, what in economic principle works without scarcity or surplus? All of supply and demand, all of behavioral economics, it all presumes scarcity. In our legacy data environment, there is no scarcity because data can be infinitely copied and copied and copied and copied as it continues to explode in disk space and difficulty in governance. By using tokenization, either tokenization of singletons like a person or something with a serial number, or tokenization of units that are replicable like a cryptocurrency, like a certificate of value of any kind, you can create scarcity and you can transact with those units of value. Please know, coming away from this, that a cryptocurrency is one of hundreds of different applications of tokenization. And last, you can have front-end Web3 applications, and we call those decentralized apps. And if they're well designed, a user would never know that the background is different. So some of the things that public blockchain delivers particularly are transparency and decentralization. When you implement blockchain networks in private, you don't have the transparency any longer, which gives you the ability to have extreme privacy. And there are new technologies facilitating off-chain computation and storage that enables both transparency and privacy to be realized in a common infrastructure. When you're selecting from hundreds of different architectural patterns, dozens of blockchain protocols, public and private and hybrid, you're always making a trade-off between three criteria, and that's the scalability of the system, its cybersecurity posture, and the degree to which it is decentralized or centrally controlled. You can correct for any two of those things as you're informing architectural patterns. And then lastly, blockchain is necessary but not sufficient in our industry. The technology alone is not enough. There are important areas where the unique requirements of our industry have to be expressed in this technology, and those include compliance, our unique cybersecurity environment, our unique privacy environment, the challenges we have with identity of patients, of providers, of devices, everything, and of course, bioethics, all of which play an important role and have a lot to do with the work that we're doing here at ConsenSys Health. So before we get into the panel discussion, I want to level set a little bit about the data-centric backdrop of what's going on here around these emerging technologies. Source data, which I'll define as any enterprise data that lives behind firewalls, or patient self-sovereign data, which is going to be exploding in scale. All of that is source data. That has been expanding exponentially for the last 15 years, and we haven't even gotten to 5G yet. And IoT is still coming forward. So the point is that source data is going to continue to explode, and presently, all of our strategies have to do with copying and moving source data from place to place and trying to centralize larger and larger bodies of source data. We also know about metadata, of course, and that's descriptions of data or source data. This is what's going to be really important in a few minutes when we start talking about different approaches of using this. But what everyone's ultimately at is actually they want to create value out of source data, which we call derived data, and that's analytical findings and insights. We believe we are in a sunsetting paradigm, and we are hoping to be part with all of our partners and collaborators of driving a positive emerging paradigm with respect to how we create value from data. In the current state, it's slow, labor-intensive, error-prone, and untrusted. And in the emerging paradigm, it will be rapid, automated, quality controlled, and trusted. Today, we have to copy and move data everywhere. Analysis can only be performed on what data that we can get custody of. And very often we make compromises by de-identifying data, and that introduces huge spectrums of new challenges and risks. In our emerging paradigm, source data will be able to remain at rest in enterprise infrastructures or in patient self-sovereign infrastructures most of the time. It will become an exception instead of a rule that the data has to be exchanged for a workflow to flow. Analysis will be performed in federated analytics models across network participants, and the source data, not 100% of the time, but again, the majority of the time, source data will be able to remain fully identified and clinically actionable without ever exposing it, sharing it, or transferring PHI. Normalization and analysis will change substantially. Normalization will occur by distributing rule sets and automating that normalization, operating on the data where it resides at its source. And the analysis will be also performed where it resides at its source, and only that derived data, the aggregated findings, will be shareable, but also cryptographically verified. So as we are continuing to see the explosive growth of data, we feel that it's time to acknowledge that we've reached the logistic extremes of data lakes and other data centralization strategies. And at the same time that we have to acknowledge we've reached the logistic extremes, we have data volume continuing to accelerate. What this means is that we have to shift to a new person-centered architecture as part of this industry transformation. And that includes 5 architectural components, all of which are interdependent and necessary for the long-term vision to come to pass. This includes a person's self-sovereign identity, that person's verifiable credentials, biometric workflows that connects the person to the meat suit, to the human animal, a self-sovereign data lake where all of that person's data about them can be brought together, but where n equals 1. And it is not a giant honeypot for hackers. It is a personal n equals 1 data lake. And then finally, the ability to transact with tokenized value, to earn, to trade, to hold all forms of tokenized value. So at this point, I would love to invite Dr. Passerat-Palmbach, and I'm glad you're still here, Dr. Manion, to dig into some more detail on the other aspects of this technology. And do we have Dr. Passerat-Palmbach? Not quite yet.
We do.
Oh, we do. Terrific.
He's audio only.
Perfect.
All right. Very good. So why don't I pause here before I get into the next part of our conversation and invite you, JPP. I call him JPP instead of Jonathan Passerat-Palmbach, to introduce yourself and talk about your background and role.
Absolutely. Thank you, Heather. Good evening, good morning, everyone. I'm Jonathan. I'm a computer science researcher by trade. I've got a PhD in high performance computing. I've been working with Heather at ConsenSys for about a year and a half now, and I'm focusing on R&D around privacy preserving technologies and verifiable computing. And ever since, I've been applying these techs to the vertical healthcare at ConsenSys Health. We are mostly interested with my team on specific technologies, some of which we will describe a bit later, like trusted execution environments, homomorphic encryption, and zero-knowledge proofs. And at the same time, I'm also a researcher at Imperial College London, where I also focus on privacy-preserving technologies, but for machine learning mostly, and with a particular focus to something called federated learning.
Thank you, Dr. Passerat-Palmbach. And before we jump into the other families of technologies and defining them in greater detail, Dr. Manion, you have extensive, many years of experience thinking about faster miracles, a phrase that you coined that I absolutely love, and how science would be blockchained by 2025, for example. And also your book, Blockchain for Medical Research, you probably have handy. Could you just give a little bit of some of your point of view about how blockchain is going to intersect with both clinical research and medicine, and your point of view on all of this?
Certainly. And starting from my first noticing this, which from the last panel that we had, Debbie Bucci's and Health and Human Services ONC white paper contest and codeathon for blockchain in healthcare in 2016 was sort of my first entry. I was a federal civilian research administrator for Defense and Veterans Brain Injury Center. I helped oversee a large network of research, 60 or so studies, a couple hundred people with partners at 17 different sites. I had a very in-depth knowledge of the challenges with data sharing, moving data across not only agencies, VA and DoD, but across into the civilian world and back again, as well as across just some of the service lines. Army, Navy, Air Force didn't all have the same systems. Local cybersecurity rules could differ, as well as the regulatory challenges involved. And this led to a less than efficient engine of traumatic brain injury research than you would expect. From really what should be a concerted effort across federal agencies. But you get large enough and everybody has to control their own systems that you weren't able to do as much as you could. I came across this blockchain stuff. I did some research on what Debbie had put together in those, or Debbie had attracted in those 70 different papers from MIT, from industry, from government. I understood it a little bit. I dove deeper in some courses, and all of a sudden my eyes opened up, and I realized that it was the change in dynamic that we needed for using data differently. With, as you said, it's cryptography that's layered on existing legacy systems. And so I started to dive in how that could happen, but I had a very functional understanding of the bureaucratic challenges, the systems challenges, and very rightly, the limits to what federal people could do to bring new technologies in. I left the federal government and had an invite back for an industry day at DoD, and that conversation really helped me along as well by letting me know what they needed. I talked to a couple of folks in DoD, and they said, we can't bring this in until we have NIST standards, until we have IEEE standards, until people are starting to pilot it in different places, and until it has a better and more secure layer of privacy, more provable. And one of the things I've found, besides finding Heather and JPP and the ConsenSys Health group to be partners in this broader vision, was that we could get this technology in place if it was wedded with other things that were also being explored. It wasn't a single key that opened the door, but a combination of keys. And I think, obviously AI and the application of decentralized AI was almost like magic to me when I started thinking about what you could do not having to move that data. But the aspects, the higher level cryptography that I won't claim to understand, and zero knowledge proof and some of the others, was that third key to just unlock the door, and using data in a different way that avoids all the pitfalls that Heather just described and avoids the challenges I found when I was in the federal government. I think, though, that it's going to take a combination of public and private partnership to really move these forward in tandem. But I think with the pandemic showing us the limitations that are already within the system, you've got everybody on all teams trying to make that happen. So if there's a silver lining to our current pandemic, it's that the door has presented itself, that we now have the keys to unlock.
Thank you, Dr. Manion. It's I remember our very first conversation we ever had in the blockchain space was about IRBs and what might be done to create, certified, credentialed, self-organizing reviewers that had incentives all around the world. It was a great conversation, and look how far we've come. It's really something. Absolutely. And Dr. Passerat-Palmbach, before we get into the individual technologies, would you just describe a little bit of how you got engaged in the blockchain space particularly? You came at computer science from other directions. What piqued your interest? And I know you did particular work also in medical imaging related machine learning. If you could just quickly comment on both of those elements within your background.
Absolutely. I came from two angles, basically. I was I was working with distributed computing and with a particular set of systems called grid computings, which are basically the ancestors of clouds and mostly deployed in academic environments. And they've got this extremely particular feature that they are highly unreliable. And that you have to come up with heuristics to make sure that the computation you're trying to achieve on them gets through. And I came across a project called iExec by a French startup that leveraged blockchain and incentives to create a grid that was decentralized using idle computer across the planet potentially. And the game changer was that for once you could implement a form of a quality of service of QoS on all these nodes that were decentralized, instead of having to do that yourself in your algorithm to expect to get a return. So that was the first application for me that totally made sense of embracing decentralization and incentives together. Now, from the privacy angle, I started to think about it when I'd been working for a while on a project at Imperial where we had to share a very large data set of brain images for children. And data sharing was not simple because you've got technical issues, but you also have legal issues. You have to agree with the hospital lawyers, for example, on the terms of the data sharing, and it's not always very well aligned with the open science philosophy that we were trying to push, let's say. And that's about the time where I came across federated learning, and mostly through an amazing project called OpenMind. That has been going for 3 years now and is an extremely vibrant online community. So that's how I connected the dots between privacy preserving machine learning and this whole aspect of decentralized AI and the potentials to add incentives on these kind of things.
That's a perfect segue into I'm assuming that the audience has a rough notion of what machine learning is generally and its power. It's been the subject of constant conversation. Maybe JPP, you could take a moment to just do a quick baseline for the audience, comparing and contrasting centralized machine learning with decentralized machine learning, and what are the implications and opportunities associated with decentralizing the function of machine learning. We will certainly dig in as well, and I'm in, your comments as well, Dr. Manion.
So the way we're doing machine learning most of the time these days is by pulling a lot of data together in a central place to curate these data, run some analytics on them, and eventually train very complicated machine learning models on them. And you can think about it it can go to a scale where, for example, the data coming from your phones up until very recently were pooled together in a single place to learn, for example, how to better predict next words on your keyboard, for example, on your smartphone. And then once a new model was ready, it was being pushed back to your phones, and that's, of course, that has very strong implications, because that assumes that all these data that we are pulling together in a central data lake are either not too sensitive, or that you're very happy with giving away your data to this central entity. Now, the difference is that instead of bringing the data to the model, we're instead pushing the model to the data, so that the data do not travel anymore in this decentralized AI paradigm. We send models on each of the locations where the data live, and it can be a mobile phone, but it can also be larger data lakes owned by institutions. You can think of the data that are owned by different clinical institutions, for example. And we are then decentralizing the process of learning by learning a new machine learning model at each of these entities. Each of these institutions will train their own little model, and the key is then to combine this new knowledge that has been learned at each of these sites, or at each of these devices, together in a single joint new model.
Dr. Manion?
I don't have too much more to add on. I think he kind of nailed it, but I think just the idea that in the future, you don't need to consider how to gather data, or on the flip side, if I'm the person who has the data, what's going to happen with my data if it's always staying at rest within my system or within my phone? And I think just that peace of mind aspect is something from the consumer or the general public end that they may not understand all the hows and whys to it, but you hear about data breaches, you hear about all of these things that happen horribly with our data. And if those were minimized or decreased in how frequently they could happen, and if I have some sort of control over my data, it just changes everything in a way I don't think we've fully gotten our head around.
Mm-hmm. And even before we would move to a learning model that was decentralized, there's a benefit of combining blockchain with machine learning, even in centralized machine learning models, which involves sourcing training data and having cryptographically verified provenance of every data element that is ultimately included in a training set, even if it's centralized. And that can go a long way towards resolving explainability problems and other long-standing issues with being able to source training data and understand where it came from, whether the data itself was corrupted, can it be trusted, and so on. So even before you get to decentralizing the learning function, decentralizing the sourcing of training data is very low-hanging fruit and represents, you know, a huge incremental benefit. But when we get into conducting learning on decentralized data, one of the reasons this technology hasn't taken off in isolation, and why we believe that the convergence of blockchain infrastructures with decentralized machine learning approaches are absolutely necessary, is that the ability to conduct decentralized machine learning has existed for a while, but it hasn't taken off in our industry. And it's because it's missing an access control layer. And by integrating blockchain with these decentralized AI tactics for training models, we're able to connect incentives. We're able to know conclusively exactly what permissions were granted by whom to do exactly what for how long, and so on. JPP, could you comment briefly on what does it look like to combine federated or decentralized machine learning with a blockchain infrastructure? What is the heart of the value prop for doing that technically? You may be muted, or you're just being very thoughtful. Dr. Passerat-Palmbach,
Can you hear me?
Ah, yes, there you are.
Yeah. Okay. Well, now it works. So just to come back on your latest comment on access control, I think for me that's the perfect point where the synergy between blockchain and decentralized AI comes into play, because we've seen a lot of applications of blockchains early on to implement consent management, but like that involved data sharing as well. And I think, of course, that's the low-hanging fruit, but that's not a fully satisfying solution in my opinion, because we come back into this problem of not being able to create digital scarcity that you mentioned in the introduction. If we just manage consent and access on the blockchain, but we still rely on our old primitives of moving data around, we come back in this paradigm of copying and creating multiple copies of the data that prevent to increase the value of these data, and also can endanger the privacy of this data in case of data breaches, for example, that are totally out of control, even though you've recorded or denied a specific access to your data.
Mm-hmm. Mm-hmm. And before we get into privacy in depth, which represents the next family of technologies, I'd like to make a point about what it would mean if you could access data in a decentralized model as opposed to our strategies today, where sourcing training data is the single greatest inhibitor to performing machine learning functions. The net of it is that it's very difficult for data scientists and machine learning practitioners to obtain the data they need to create models. In this decentralized approach, we can turn the scarcity and the behavioral economics of that dynamic completely upside down and access vast data sets without ever having to centralize them. I know you've been a data scientist for a long time, Dr. Passerat-Palmbach, and you've experienced this too, Dr. Manion. Could you comment on the difference about the amount of total data and the degree to which we could trust that data and its provenance in this new decentralized, blockchain facilitated decentralized AI? Dr. Passerat?
Well, so I think in terms of quantity, you just have to look at most of the studies that are being run on healthcare data, for example, and I guess it's pretty rare to reach very large scales in terms of data, unless we're speaking of very carefully created data sets, like for example in the UK we have an initiative called the UK Biobank that aims at collecting data from about 100,000 patients once it will be completed. But that's an extremely complex endeavor to put into place, and extremely costly as well. Whereas if, as you were explaining, you flip the paradigm around, and now everyone is able to contribute their personal data or healthcare data, or even connects data that you would not think are related to your health in the first place, from let's say a mobile application on their phone, and are able to receive a request by a clinical trial project, for example, that would be willing to use this data. And I'm really careful on the wording I'm using. It's really using this data and not transferring this data, owning this data.
Or even allowing the party who's using it to be aware of its content while it's being used. So
exactly.
Even if giving a party permission to use it, that party cannot see it, doesn't know what it is never going to know what it is.
It's never going to know what it is, and we'll have, because of that, an incentive to potentially come back and request more data, instead of accumulating and stashing all of this data somewhere on their infrastructure with the hope of potentially use them someday. So we're shifting from a logic where you could, I mean, I'm not saying that there's no way in the current state of how the industry works to monetize your data, but by doing so you would literally sell your data once and for all, and by doing so creating a new copy. And what we are discussing here with all this decentralization is switching from data selling to data lending, in a way.
Mm-hmm. From purchase to leasing models, absolutely. Before we move into privacy in depth, there's one other key point that I think bears mentioning, and that's the notion of secure inference. And inference is the function of a machine learning model making a prediction. So after a model's been trained and it's doing what it's meant to do, it's making a prediction that might guide clinical decision making. It might guide patient behavior. It might guide access to care. It might guide anything where these technologies are implemented in our industry. We must know that we have a deployment model for machine learning models that allows us to assure the cybersecurity of those models, assure that they have not been corrupted, assure that the infrastructure that's deploying them is trusted, and so on. Or we will not, no matter what happened with training data, we cannot trust the piece of software that is the model itself, that is making the predictions, that is informing decisions. So secure inference is something that this combination of technologies uniquely can provide. And I'm wondering, JPP, could you put a fine point on the difference between inference generally in machine learning and what we mean by secure inference when it's implemented in a blockchain, in a decentralized blockchain-based architecture.
So the typical way inference work is not too dissimilar from the old way of doing training. You would have, as an end user interested in leveraging the prediction capabilities from a machine learning model, you would have to send your data to a remote server in order to obtain the prediction that you're seeking from this model, and you would have to hope that the server is applying best practices and is not storing your data beyond the time that it needs to perform the inference. Now, in the secure inference model, your data remain encrypted in use. So when requesting the prediction, you will transfer potentially your data, but only in an encrypted fashion. That's one option. And even when this piece of data reaches the remote server that hosts the intelligence, it would remain encrypted during the prediction. So at no time your data will be decrypted. Another option to implement secure inference that could potentially be seen as even more decentralized is when I was describing this deployment of machine learning models on mobile phones, for example. Well, that's also a way to do secure inference. But this time, what you're interested in is to verify that the model that's installed on your phone is exactly the model that you're expecting, and that it is giving you the level of predictions that you're requesting, because the outcomes can be quite significant.
Mm-hmm. Thank you for that. And so before we move into privacy in depth, Dr. Manion, do you want to comment on this combinatorial effect of blockchain and decentralized machine learning, or should we go on to privacy in depth?
We're pushing against time, so only 7 minutes. So I'll just say briefly that the combination is sort of that data holy grail that I think is missing from a lot of the somewhat fragmented or firewalled or siloed systems that I've seen and are currently in place. That if we could just open those things up a little bit better, and you open them up by not allowing everything from them to be handed to everybody who accesses it, I think that's the way we can free up a lot of the research to just move ahead faster, get more eyes on it, get more access to data in a limited way, but in a controlled and limited way that allows discovery without exposure.
So I would suggest that blockchain and decentralized machine learning architecturally are intrinsically privacy preserving by comparison to legacy technologies. However, when you layer those two technologies with a third family of emerging technologies, that's where we believe you now have the complete technology stack that is both necessary and sufficient for the needs of our industry. And we've labeled that third bundle of technologies as privacy in depth. These are all, generally quite new. And when technically integrated and combined with blockchain and decentralized machine learning, you have really radically enhanced cybersecurity posture, a profoundly different privacy standing and optionality than you have in any legacy system. And very critically, you have the ability to trust the entire infrastructure stack involved with provisioning that service to whomever its target users may be. I'm talking about the memory space, the cloud instance, the hardware itself, and as well as the application layer. Do you know that the executable hadn't been corrupted? The data itself, has it been corrupted? The entire stack can move to a state of trusted and verifiable infrastructure, which is not present in any way, not even remotely close in our current models. So we don't have a lot of time left, but zero knowledge cryptography is, I believe it was Isaac Asimov that said any technology sufficiently advanced is indistinguishable from magic. Dr. Manion made a joke about not being able to understand zero knowledge cryptography. And we actually have a zero knowledge cryptographer on the line with us here in Dr. Passerat-Palmbach. Dr. Palmbach, could you do your best 30-second, simple for lay people definition about what zero knowledge cryptography is and why it is substantially different from, let's say, legacy cryptographic models or methods that are used generally today?
I'll try. Zero knowledge cryptography has been around for 30 years, but it's gained traction over the last couple of years, thanks to blockchain actually, because that's the piece of technology that allows to add privacy on top of a blockchain network that's known to be public otherwise, and to implement such things as private transactions, for example. What you're doing, what you want to achieve with ZK cryptography is to prove that a statement is correct, is true, without revealing that statement at the heart of it. That's what it is. So it's to prove that you know something that you want to keep secret, and to convince another party or the rest of the network that you do actually know this secret, but that you won't reveal it. How do we use it in this whole stack, for example? Well, you could add some more authenticity on the data. For example, if I give you, if I allow you to run a private inference on my server, and I give you back a piece of encrypted data that only you can decrypt. Now, if I ask you to send along this piece of data that you obtained from an encrypted computation to another element in the network, how does that element know that this piece of data is the one that you've obtained from the other party? Well, there's no way to do that unless you give a proof, a cryptographic proof, that the data actually came from the location you expected.
The example I always give is, think about your birth date as a data element. And every time you have to enter your birth date in order to demonstrate your age for whatever reason, maybe to pass go on any kind of workflow, in a world where zero knowledge cryptography had been brought to global industrial scale, the data element of your birthday for those purposes would almost never need to be transferred. And instead, a cryptographic proof that your birthday was higher than or lower than or within the decade of the requirement would be what is persisted in the other system. Your birth date would remain at rest. And that's just one simple example. If you imagine all of the data that is involved in clinical, scientific, and business workflows in our industry, how often that would be useful. Remarkable. And in our last couple of minutes here, I want to highlight the verifiable and confidential computing, which is a critical portion of this, which is what brings the rest of the infrastructure, not the data, not the software running the compute, but the memory space and the hardware, which also has to be trusted for this to work at scale into the mix. And I'd like to ask, as we close out, before you make your closing remarks, Dr. Manion, could you please define briefly, Dr. Passerat-Palmbach, the difference between a trusted execution environment and out of the CPU, like with Intel SGX, or memory space, like secure encrypted virtualization out of AMD's offering? Just define what it is in a nutshell, 30 seconds.
It's a piece of hardware, as described, that allows you to create an encrypted area of memory in your computer that no one can access unless you're the one that have been creating it. So in a cloud environment, it means that not even the cloud provider can read the memory of the program that you've created using this technology, for example.
Thank you. And elevated compute is ConsenSys Health's unique integration of these three families of technology: blockchain, privacy in depth, and decentralized AI. And if anyone is interested in speaking with us about it, you can contact Betsy Dalton at ConsenSys Health.